The Abdul Latif Jameel Poverty Action Lab. Translating research into action.
Work. The research team and the implementation team were working incredibly closely together. So when Shahana talked about the situation analysis that was done to try and understand what were the issues on the ground, which was the very first step in this process, we had someone join their team and work with them to help with the situation analysis. And then we did this workshop together and also spent time in the field together trying to figure out, as Shahana talked about, what does an empowered girl look like? Because if you're going to try and measure whether you've changed in the level of empowerment, you have to be very precise about what you mean by empowerment. And so, as a joint team, and with lots of discussions with girls in the field, we came up with that list that Shahana went through of what does an empowered girl look like. I'm going to talk about the next stage, which is how do you turn that into actual indicators that you can ask of a survey. So this is the list of issues that we jointly came up with, which Shahana talked about. And our challenge, which is where the research team was in the lead, but where we also continued to include and discuss with all the implementing partners, how do we turn this into indicators? So I'm just going to dive into more depth about just a couple of them, because I can't possibly go through how we measured every single one of those, but just to pull out some of the challenges in turning those into indicators. For the first thing that I want to say is we had two kind of big overarching objectives. One was to delay marriage, because we're talking about a population where there's a large number of child marriages, which is then leading on to child pregnancies and a lot of reproductive health issues associated with that. So that was one key outcome. Another was education, so encouraging girls to stay on at school. So those were two overarching important outcomes. Within that, though, there was a bit of a trade-off between getting it very precisely from a fewer number of girls and getting a very simple indicator that you could get from many girls. So we did both. So in every village that we worked in, so 460 villages, we had a census of every single adolescent girl in that village. And when we went back, we asked whether she's married of every single girl in 460 villages. So a very simple question, but from a lot of people. And we've just been calculating, doing this at the next round, with 75,000 girls we're going to have to track. So that's a lot of people, but a very simple indicator. And then, to get more detail about those marriages and when they happened and to actually get a date, you need to take longer. And that we did in a subsample, a random subsample of girls we had longer interviews with. Similarly, on education, you can ask the simple question, is she still in school? And we asked that of every girl in all the villages. And then we went to do a much richer discussion and collection of indicators for a wider group of girls. So there's always this trade-off between do many people at a very simple level, or do you go into depth with a fewer people. So delving down into the long list of, those are kind of our big key outcomes, but then if you're looking at empowerment, it has all these many aspects to it. So how do we get at those? One of the key things that this program was designed to achieve was looking at financial capabilities. So we have a whole set of questions about income generation. What are these girls doing for income generation? About credit, are they borrowing? Not really as girls, because none of the microcredit organizations will take girls, but as they start to mature into women, are they accessing credit? And are they saving? And this is something that was quite interesting. The baseline was quite a lot of girls who were saving, even small amounts. And that information from the baseline actually fed into the program design, which is why they added the savings component, the savings club. because they discovered that some girls were saving just from gifts they were given, or from the female secondary school stipend was another important source. Health, we cared about, was one of the aspects that came out in terms of an empowered girl was a healthy girl. But there are many aspects to health. So there's physical health, which we measured with anthropometrics, so height and weight. Health utilization was a key measure of empowerment. So we asked about whether girls were accessing, when you were sick, did you go to the doctor, did you access services? We've actually got that for boys and girls in the same household. So we found that boys go to more formal health seeking than girls when they're sick. So that's a measure of gender disparity. And then we also cared a lot about mental health. So for mental health, we wanted to use, there are commonly accepted sets of questions that get at mental health. So we wanted to use something that was a standard indicator that people could compare to other contexts and say, how are girls, what's the level of mental health of rural girls in Bangladesh compared to India, compared to Kenya, compared to other places where this standard measure is used. So there's many benefits of using a standard measure. However, some of the questions had to be changed because they simply didn't make sense in this context. You had to ask them in a somewhat different way. And all of this, of course, requires a lot of field testing. Gender attitudes is another important thing that we were seeing if it was going to change. And what we realized, and anyone who's done survey work realizes, if you ask a question like this too directly, people will just answer what they think you want them to say, rather than their real beliefs. So that's what they're meant to say. So instead, we tried to ask questions that it wasn't shameful to answer either yes or no to. In particular, we looked for attitudes where there was a real difference in the population, where some people would say yes and some people would say no. So we asked about, for example, is it okay for a girl to be more educated than her husband? Well, even in the US, some people say no, it's not okay for a woman to be more educated than her husband. It's socially acceptable to say that the husband should be more or they should be the same. But it is, so it's something that some people say yes to and some people say no to, but that's kind of what we're looking for here. So they're very specific questions rather than a general gender question. Now I'm going to go even more into detail in one particular area, which is mobility. And mobility is something which came up again and again and again in our initial discussions about what does an empowered girl look like? An empowered girl is a girl who is able to overcome mobility restrictions in order to access health services, in order to go to school, in order to be sort of self-fulfilled. So we started off with a very simplistic idea of what mobility meant. A girl could go, could work, was able to move within, was her restriction within the para? Was it within the village? Or was it within, half an hour's walking distance? We very quickly realized in piloting this that that was not a good way to think about mobility. Why? Because it became very apparent that a girl's mobility depended on what she was doing. There wasn't, if you like, a concentric circles. If this woman could go within the para but not within a village. Well, she could walk within the village if she was going to school, but she couldn't walk within the village to do something else. So the restrictions are extremely complicated, and if you ask too simplistic a question, you're not getting at them. It depends who she's going with. Obviously, most girls can go anywhere if they're going with their father or their brother. So when to say, can you go? But if you say, can you go alone, that's also not really what you're getting at. Where you can go, with whom, to do what? So if you're going to school, can you go on your own? Can you go with friends? She could go do an errand for someone else. She could go do education, but she couldn't move around. And so we end up with a question in addition to the girl of, have you ever been to a fair with your friends? Again, she might not want to go on her own. but that's something that clearly has no utility to anyone else. It has utility to her. And I think that's the essence of empowerment, and that's. But would I use that question anywhere else other than Bangladesh? Probably not. So that you have to do in defining empowerment, we have to think so carefully about the context and what makes sense in this context. What does an empowered girl look like in this context? So we have these very large number of questions in our surveys, which brings us to another challenge of measuring empowerment, which is a more technical, more statistical challenge, but it's something that everyone working in this area needs to worry about, which is, I'm going to go back and talk about statistics for a minute. When we talk about whether it's a significant result, so a significant difference between the treatment group and the control group, the way we test that is we talk about, the result, the difference is significant at the 5% level. We use that as saying it's statistically significant. What does that mean? That means there's a 5% or less probability that the difference came about by chance. That's if you ask one question. If you ask many questions and you use the same statistical significance for each of those, by chance, some of those are going to show up as significant. So if we test 10 questions and we impose the same significance level, we get a 40% chance that at least one of them shows up as significant. So what you can't do is ask 300 questions like we do and say, oh, one of them was significant, the program worked, because there's a very high chance you'll just get that by chance. So there is a bunch of statistical things that you can do. You can combine all your mobility questions into a group and test them as a group, which is what we did. You can write a pre-analysis plan where you write in advance how you're going to analyze the data and what you're going to take as this being an effective program. So we did all that.
Couple of questions. I think I'll take 2 questions and hand it over to the presenter. Shailesh can bring you over a mic.
Thank you. Thank you very much for a very nice presentation. I'm just curious to know when Dr. Nandan was talking about what empowered girl look like. In the context, and Dr. Rachel actually talked about the behavior very as it occurred. How do we address that? Because that part disempowered girls a lot. That actually hits their personal self-esteem and other things. So I'm just curious, is there any way we can actually include that in the whole thing? Thanks.
The barrier for empowerment, and that has been included in our education session, and also we provided life skills so that they can use it for preventing sexual harassment at the community level. That's been done.
We strategized about what we would do, and we do have questions on it. It's within one of those families. We do have questions on it. Obviously, the challenge in measuring it is whether people are going to tell you about it. We try, and we talk about Eve teasing in the indicators, so maybe focusing not on kind of some of the worst forms, but some of the more marginal forms. Obviously important and serious, but because we think people might be more willing to talk about them, we're at the moment trying to design the survey for the next round where most of the girls will be married, where we get into much more challenging questions of sexual harassment within your new family and as a married woman. And as I say, the real challenge is if a more empowered woman is more willing to speak about it, it may show that the program made it worse when actually it's just that she's more willing to speak about it. And that's just a constant problem when you're talking about these issues. But I think the main way we tried to talk about it is, we tried to measure it is, as I say, in the context of Eve teasing and sort of what you would do about, what should a girl do about it. Sometimes hypothetical, so you didn't have to talk about yourself. So that's, I'm not saying it's perfect, but that's how we tried to tackle it. And then we randomly picked some of those to go into depth. But then we also went back to those households that had adolescent girls and asked a few short questions. Is she still in the household? Is she married? Is she still in school? And so last time we did that, so anybody can answer those questions. You don't have to find the girl. You just have to find, because you're asking questions that anyone in the household will know, so it's slightly easier. When you do the in-depth, when you pull a random sample and go into a lot more depth, you have to find the actual girl and sit down with her for an hour and a half or 2 hours. So that becomes harder, especially once she's working in a factory and you've got to persuade her to take time, spend her precious few hours talking to you. But the census was specifically designed so anybody in the household could answer it, so it was easier. Our tracking rate there is much less than it is. It's only about 80%, I think, when we're going after every girl. This time around, we want to get it up to 90%. The tracking rate of the subsample of girls, we get very, very high tracking rates just because we went back and back and back until we talked to her. We even went during Eid to her parents' home because she would be going home. So other girls we couldn't get any other way. We paid surveyors to show up during Eid when she's very likely to go home, and that was very successful. I wanted to be able to say, was the impact of the program the same on malnourished girls versus non-malnourished girls? So that was the original reason to do it. It wasn't really as an outcome measure. But then given that we got that, we thought we could use it as an outcome measure. Now, I'm only really just getting into nutrition. I'm doing it in some other areas too, so I'm not really a nutrition expert. I'd love to talk to you afterwards. One of the challenges is people who say when you analyze this, you need to have, you need to know the girl's age to within a month. To which my response is, you will never know within a month the age of a girl in Bangladesh. It's just not. You can pretend you know it, but you don't have it. And we have 3 measures of ages for these girls. They're all different. We asked them the same question 3 different times over the space of 4 years. They're all different. So that's a challenge. On the other hand, that should all wash out in big samples, and we're talking about very big samples here. The reason we think it might be an indicator is, a third of these girls are stunted. If you do an estimate, if you sort of apply standard rules and you think you've got an age, they're stunted. The other thing is that people talk a lot about girls not getting enough to eat, eating last. And this is something that was a very important part of the program. They were taught about that, about what were the necessary food issues. And you could say an empowered girl is someone who negotiates to get more food, and they're clearly not getting enough food, these girls. So that's the pros and cons of using it. I'm not saying we have a simple answer.
Just a small request. I would request you all to note down your questions. We have a dedicated question and answer session at the end of all the presentations. So we just want to have like 2-3 quick questions after every presentation, and then we can go all the questions later. Thanks. So we move on to the next.